novel coronavirus.
Right now, it may seem things like PPE, N95 masks, and contact tracing are things of the past. But one team of healthcare workers at Providence Sacred Heart Medical Center in Spokane were making preparations long before COVID was a household name. 4 News Now's Natalie Grant brings us inside this special unit and shares the important role they still play now.
I'm not feeling well.
We all know that COVID brought a lot of unknowns.
Okay, what is this? How do we treat it?
But for one team at Providence Sacred Heart Medical Center in Spokane, treating the unknown is what they know.
We didn't know much about the pathogen that we do now, and so it was a perfect use of our team and our space.
The Special Pathogens Unit team is a combination of nurses, doctors, therapists, and more that are already working at the hospital. Since 2015, this team has gone through thorough and meticulous trainings about care, protection, and prevention should a high-consequence disease come to our region. And in 2020, it did.
We've been activated once, February of 2020, for patients with the novel coronavirus at the request of our federal partners. They were under federal quarantine at the time.
Right now, the beds here in the Special Pathogens Unit are empty. But if another high-consequence disease were to arrive in our region, this special team of caregivers would be ready to activate.
We all know those things are out there, right? And they crop up and they turn into pandemics. We had, the flu in 1918 and what that looks like. And, so there's always that possibility.
Nurses station.
Sacred Heart is one of the 13 units of this kind across the country that is designated by the federal government to respond to diseases this way. And with that comes federal funding and state-of-the-art technology ranging from labs to regional coordination and even how items are sanitized and disposed if they were exposed. But even with all the resources, nurses like Marnay Farron say it was their years of training that was the best tool of all.
It's kind of cliche, but knowledge is power. And when you have that extra knowledge, then just makes your job easier because those fears, those concerns kind of get washed away and you're able to just focus more on taking care of the patient.
And even though COVID has lessened its grip, their work is not done.
High consequence but low frequency events, right? That ongoing preparedness and training is essential to maintain that state of readiness.
Prepared for whatever comes our way.
Natalie Grant joins us now in the studio. Natalie, COVID is no longer a federal health emergency. What does that mean for this unit now?
Yeah, absolutely, Aaron. I spent the day with this team here, and I learned a lot. It means that they're no longer activated as right now, and they go back to their regular positions in other units of the hospital that they were originally hired on with. And the ones that I spoke with today say they've been able to bring back some valuable lessons to those units with them after leaving, after they were done being activated.
And let's say another disease were to pop up, something like we saw with COVID. What would it take to activate that unit once again?
Well, back in 2020, it was an activation by the federal government at that point there, and after the first patients came off the cruise ship and needed treatment here, as I'm sure many of us remember. But now, even if there was one case of that high consequence disease, something like Ebola, which they prepare for very often in states of Alaska, Washington, Oregon, or Idaho, that would be enough, just one patient, to bring that team all back together.
Good to know. Natalie, thank you.